Hey folks, how's it going? Thanks for joining us here today for this webinar. We're really excited for you guys to join us here. As we wait for folks to trickle in, I'll actually go ahead and introduce myself and my colleague here. My name is Karani, and I'm an integration account manager here at Fullscript. I actually work with our integration partners to launch and optimize them, as well as train and educate our practitioners and our joint users on the integration. Of course, I'm not venturing alone on this webinar. Joining me here today is Alex Hamilton from Jane. Hey, Alex.
Hey, yes. That's me. I'm Alex from Jane. I currently work on the content side of Jane here, creating guides and different content for our practitioners and customers to use and utilize. I formerly worked on our customer support team. So if you've ever called Jane support or any of that, I've definitely had experience with talking to those people over the phone lines too. So yeah.
Amazing. Thanks for joining us, Alex. We're actually going to kick off this party here. But before I do, I really want to mention that if you have any questions at any point during the presentation here, please ask away using the question tab in the webinar platform. We do have people online. They'll be able to answer them via chat. And Alex and I will also be able to get to those questions later on in our session here. For those that might experience any technical issues, please don't hesitate to let us know in the chat box. And finally, if you do need to hop off for whatever reason, no need to fret or worry. We got you covered. We'll be sending you a full wrap up with the recording in the coming days here. Now we're gonna go ahead and switch over slides here. And we do wanna be mindful of your time. So we put a little agenda so you guys know what to expect. First of all, we'll begin this webinar by going into and talking about setting up your virtual practice. So how to get started and things to consider when you're moving your practice to the online space. Specifically for this webinar, we're actually gonna focus on the technology you can use to set up your virtual practice. After that, we'll run through the benefits of having a virtual practice before we move into the demo portion of this webinar. And Alex will actually take over and he'll actually show you the 3 ways you can automate your practice using Jane and increase that practice efficiency. While working in Jane, we'll also show you how easy it is to incorporate Fullscript supplements into your treatment plan before we move back into the slides and then talk about the benefits of the Fullscript and Jane integration. Finally, we'll open this all up to a Q&A session at the end. So if you have any questions, please ask away in the chat box there. Sounds good?
Great. Sounds good.
Great. So the next slide you're seeing over here is setting up your virtual practice. We understand and we're very mindful of the fact that the current global health crisis has really forced practitioners and even the industry as a whole to pivot and change the way they provide care to their patients. However, that need to change the way healthcare is provided has actually always been there. The healthcare crisis just accelerated this need altogether. Now, one of the tools that practitioners are using from their arsenals that are having success with is moving their practice to the online space. And this trend is actually going to continue going forward. And a big driver of this trend are actually patients and consumers. They're the ones who are demanding this. Even traditional face-to-face types of care, such as mental health, asking for a prescription, are moving to the online space. And this is the reason behind it is because they're offering them the patients here the convenience to access that type of care. Now, understanding that today's practitioners must be able to master the different skills that are related to using digital devices or online solutions, and mastering those skills is now a crucial skill set that all practitioners are required and need. And we're kind of mindful of the fact that moving your practice online is a huge undertaking since it has so many moving parts. And we want to provide you some considerations here that you need to think about when moving your practice online. And again, we're going to focus on the technology itself. So finding or having the right tools here is important because it helps make the transition as painless as possible. So there's three considerations I have here. The first one is privacy. Privacy is really important because it refers to the legal requirement that needs to be in place to provide the online care in the first place. So for practitioners in the US, the solution needs to be HIPAA compliant. A HIPAA compliant solution is a solution that integrates and satisfies all government requirements of patient confidentiality. Now, the Department of Health and Human Services outlines 4 main areas for practices to be compliant for technical safeguards. First one is access control. As the name suggests, you're basically controlling the access to who, here, let me take a step back here. You're controlling who gets access to the protected health information. One example here is providing unique online identifiers for all employees to track their activity and identify them in all their virtual movements. So, such as logins here, cards, you'll be able to track that information right away. So only individuals that are authorized to see that health information are able to see it. The next one is audit controls, and this actually refers to system that records to track and tracks all activity that occurs in relation to protected health information. This is really, really important because if there's any risk, if any risk is determined to have come to the protected health information, then it's actually possible to see exactly who accessed what information and when they access the information and why they access that information. So it actually ties into overall security health. The third one is integrity controls. It actually involves ensuring that protected health information and other health data is not changed or destroyed in any way. When PHI is altered or deleted, that is a huge, huge red flags. Health organizations can experience quality of care or even patient safety concerns. So that's a no-go area for anybody. Finally, transmission security. And actually that ties into, that really ties into protecting health information from unauthorized access when it's being transmitted electronically, whether it's through email, whether it's through between system. It's really important to have that security there. Now, for Canadian practitioners, PIPEDA or PIPEDA is the regulations that you have to be concerned about. For the most part, it's actually the same requirements as HIPAA, but it does have some additional requirements centered around patient data and where it's stored. Now, why am I going through this? Well, as a provider, you're actually responsible of the safeguarding health information. So it really ties back into you and what you're doing. So some of the things you can actually do to protect yourself, and some of the things you can actually incorporate to make sure that you're meeting those technical safeguards are: do not use unsecured public wireless access or networks. All system access and all system applications and devices should be behind the firewall with adequate anti-malware and antivirus software installed. Ensure that software devices are used and updated regularly as they made available. Avoid recording virtual consult containing personal information or clinical information unless it's absolutely necessary. And finally, making sure cameras and microphones are disabled when not in use. We've all heard those stories where somebody had left their camera on or left their microphone on. It might be hilarious for us, but for that individual, it is tragic, and it has led to repercussions.
Alan, if I may jump in here too, cameras and microphones, this disabled thing is really important, especially with the I guess comeuppance of all of our smart home devices and all of that, saying like, hey Google and all that, they're always listening. So it's also important to disconnect those sort of devices too, not only just your cameras and your microphones on your phone or something like that.
Absolutely. And when you're actually having sessions with your patients here, make sure that you're conducting this virtual consult in a private location, and always ensure that the patient is ready to have that confidential conversation with you. We want to make sure that they understand what's going on before you proceed with your session with your client here. Now, the second point here is interoperability. What I mean by that is how well the tool integrates with existing solutions and systems that you already have in your practice. Why this is important? Well, some of the benefits of having a well-integrated practice are increased practice efficiency. So presenting data to care providers in real time and in consistent manner can boost efficiency across the practice itself, which leads to less medical errors because you get the practitioner here gets a complete picture of their patient. And then finally, it increases patient experience. And this actually ties into our last point here. So patient experience, it's great that you have a solution that actually meets privacy requirements and that it works well with other solutions that you're leveraging. But if it's clunky or if it's difficult for patients to be able to access the portal, your job as a practice, if it makes it difficult for the patients to access the portal, that's a big no-no, because your job as a practitioner is to make it easy for your patients to access the care that you're providing. Patient experience directly impacts your bottom line here. A US practitioner can lose up to $10,000 a year per patient because of that loss. Now, to ensure that the patient experience there for the right tool, make sure that you do some test runs with the tools that you have, whether it's a telemedicine solution, practice management solution, or emails. You make sure that you have the right tools and you actually test it out, whether with a family member, a friend, or a colleague, so you understand the patient experience before moving on. Now, as I mentioned there we go. You beat me to the punch. So there are many benefits to a virtual care, and they extend to all members of the healthcare continuum. For the patient here, we'll enjoy greater conversation and elimination of the need to travel face-to-face visit. But it is important for the practitioners, for you guys to actually educate the practitioner or the patient about your virtual services, ensuring that there's adequate time to set up expectations, answer questions, and discuss how to remote monitoring can assist them in reaching their goals. So educating your patient is really important here. For practitioners, nurses, and caregivers, they'll experience a more flexible schedule and improve access to patient information. Finally, for healthcare administrators, it lowers medical expenses and boosts product operational efficiency because you're lowering the overhead costs altogether. Now, I know I rambled on there for a bit. What we're going to do is jump into the solution here. And Alex, you can take over and show them what we're meaning here.
Perfect. Yeah, I would love to. And that's such good context for everything that we're going to be showing. So keep those things that Alan said in mind while we're going through Jane here. And while I do that, let me just switch over here. And when I switch over to Jane, you're going to get a nice view of our schedule here. And so to start off our demo of Jane, I like to start on our schedule. And the schedule is basically, we're going to spend either most of your time for the day, or I mean, when you're scheduling patients, it's an important step to learn before getting into the rest of, charting and the patient experience and all that. So let's look at the schedule. On our schedule here, let me just, move some of these windows here. On our schedule here, I'm signed in as our demo owner, and this is just our demo clinic owner account. So he has access to basically everything on this clinic. On the left-hand side, I have all of my practitioners who's going to be working with me or at the clinic. And then in the middle here, I have all of my appointments that are either already booked today or have already been seen for, the day already. So when it comes time to booking a patient visit, on the left-hand side, I have these customizable appointment types. So this could be anything from like a 30-minute return visit, 60-minute new visit, but you can customize these to whatever you might need. Michael Carroll here, he's a naturopath. So we're going to book a patient in for a new patient visit. We'll then click into the schedule, and Jane's going to then reserve that for the next 10 minutes so that no one else on your online schedule or someone else at the clinic, they can't just come in here and scoop that time up. On the right-hand side, when I do click onto that appointment, I'll have the appointment panel, and we have our section here where we can add our patient. So if I want to type in, Maxime, I already know they have an account. I can add in their name here, and then their profile will pop up with all of some, information that they have already. So they have 32 upcoming appointments, when their last visit was, if they have an existing account balance that they need to pay off. Jane's going to let you know all of this. Another really cool thing from this section is you can also just, if the patient doesn't have a profile already, we can click New Patient right here and create our patient profile directly from this screen. So you don't have to go around and click into the Patients tab and suffer all of that finger fatigue, I like to call it, of clicking around everything. Everything in Jane is designed to flow well. But as here, we can type in their first name and last name. So I'll just stick with Maxime, that's fine. We can enter in an email address here. So if I want to enter in, let's actually enter in mine here. If you need to email me, you can also type in here. And if I need to enter anything else about this patient, whether it's their street address, their home phone, or whatever it is, I can also do that myself here as well. One cool thing about Jane is that I don't really have to do this, as if we do have automatic intake forms set up, when I book this patient in for a visit, I can send them a welcome email, and that'll prompt them to enter in that information themselves. So if I don't necessarily know where they live or anything like that, when I book them in and send them that welcome email, they'll receive everything that they might need to start booking any appointments online themselves. So I will then go ahead and I'll book this appointment down at the bottom here. Jane's going to then turn that into this nice blue state or whatever color I associate with that, and we'll have that booked in. On the right-hand side, once the patient comes in, we can click that they've arrived, and you'll see a whole bunch of different information here. So they've come in, we can arrive. We can also no-show them if they didn't show up. You can, if I click out of arrived here, we can also book them in for like recurring appointments if we need to. So if, say, we want to see Maxime every Tuesday until May 27th, that works great. Jane's going to then list down below here all of the available times in blue, and anything that there might be a conflict in our schedule, there's someone already booked there, I can then click on a different available time that's available. So this is one of those great ways of automating your practice a little bit, even though it is a little manual here, but automating that kind of booking process. I can then book these 4 appointments for our patient. They don't have to worry about booking these or calling in on us, and we can save our time for other things like actually treating our patients. Otherwise, we also have a section for any sort of notes here. If I need to type about maybe they're going to be 5 minutes late or any internal notes you need to write about a patient, you can add that as a note. And if I hover my mouse over, I can see that the note, they're going to be 5 minutes late. And you can star these notes, and if there's something, maybe they're always 5 minutes late, or maybe there's something important to tell them the next time around, you can always star these and have a recurring reminder at least. There's a whole bunch of other stuff in here that I'm not going to get too much into, but otherwise you can also manage any of their appointment prices within the billing info section here. You can see their invoices, you can send that to them by email, so on and so forth. And then also if you're accepting insurance and all of that at your clinic, you can add a policy here and type in any sort of billing codes or procedure codes that you might need as well.
I think because there's a lot of questions coming in here. I want to ask one right away. So what are the tools? The practitioner had a question asking about what are the tools in Jane can we use in our day-to-day to mitigate patient touching or holding things at the clinic?
For sure. It's a really important thing nowadays, especially with our current protocols of social distancing and all of that. And within Jane, we have a slew of different things that you can do for this. Say you're still seeing patients face-to-face, but maybe you don't want them sitting in your waiting room or anything like that. We have what's called a patient self-check-in here. We can head into our settings, go into our online booking, and then if you head down to the very bottom of this online booking section, you can click view signage here. And essentially, Jane's going to create a a QR code, which any patient, you could just post this in your window or somewhere at your clinic. Any patient that comes in could then scan this QR code, and then they would enter in their, log into their patient profile. Jane would then see they're signed in for, 12:30 on Thursday. They can then check themselves in, and Jane will then recognize that and then let you as a practitioner know that they're ready to be seen. So that's one really cool way. Another way that we have is all of our online booking tools, and as well, there's online payment and stuff. So let me just hop to our online booking site. You can see it's demo.jane.app right here. This would be a different URL. It'd be your clinic name.janeapp.com for your own website. So when you sign up for a clinic at Jane, you get your own website here. Patients can come on, they can book an appointment at either of your locations or with a specific practitioner on the right-hand side here. But I'll just click the village. And then listed below are all of the different options that I can book in my patients. And you can see we also, looks like someone on our demo site has set this to French. You can see we also have some translations here too. But as you can see, maybe I want to book in a, let's say, a naturopathic medicine visit. Once again, I'm a new patient, so I'll click the 60-minute new patient visit. And Jane's going to list on the right-hand side here all of our times that we could book in that 60-minute visit. So say 12 o'clock. Now it's in French, but this would be I'm done. This one could be like, I want to book some more appointments as well. If I want to book another appointment, say, later that day as well, I could do that. Say I'm done. And as a patient, I've just booked in 2 appointments. This is all in French, excuse me. Just give me 2 seconds here. This is not supposed to happen. Of course it happens, in our demo though. That's great. But let's just switch this back to English. I'll save that. We'll go back into our section here, refresh, and now we're back into English. Perfect. So I've booked in the following appointments. I have my dates and times. And we can also set it up so that patients, when they book these appointments in, they won't be able to actually book them in fully until they either enter a credit card in or either a prepayment online too. So let me just set that up as well. Excuse me, I had this prior set up, but it looks like someone's taken it off. But if I go into my online booking, this is an option anyone can use using Jane Payments. Maybe our payment requires full payment before showing up, so we don't have to touch any credit cards. They don't have to touch our POS machine or anything like that. And if I go to book another appointment here, we'll book with Dr. Marcus, new patient visit, 12:05. I'll click continue. And then Jane will ask me to provide some credit card information here. And once I do that, this is all definitely real. Please don't use this. 29 and 1111. And of course, it's not going to accept that. But typically, if I had a real credit card enter here, I could click pay, and then that patient would already have paid for their appointment, and then we won't have to touch their credit card or anything like that either. So that's just one of those cool ways of letting us avoid any sort of touching or interaction with that patient and kind of limit our face-to-face interactions with them. But from there, so you've seen the online booking site, you've seen from our schedule here how to book patients in. Once the patient's in, you're probably asking, what do we do? What happens when a patient's arrived for their appointment? And with that, we can start charting for the patient. And
actually, before we get into the charting right here, another question that did pop up from a practitioner is, what sort of resources does Jane have for clinics just getting started?
Such a great question. Such a great question. And like I was mentioning before, I do work on the content side of Jane, creating guides and such for our practitioners to use. And you can head over here to jane.app/guide. You'll bring us to Jane's guide. You can see my face right here. And in this guide, we have everything available for you, everything from like a quick start if you just need to get your clinics up and running. There's a 5-step program, basically entering your clinic information, your disciplines, your treatment, staff, and schedule. We also have training for front desk, which has everything from modules for them to test. They can come into this demo site, test things out, and the same for practitioners as well. Any question you might have, you can search it up here. If we've been asked a question more than twice here at Jane, we've basically created a guide for it. As well, further to that, I like to mention that included in your pricing plan, your subscription plan, email and phone support is entirely included. Importing your data is entirely included, so you don't have to start from scratch when you're starting from Jane. If you're also using like another EHR or something like that, you can also import all of that data into Jane really easily, and our team will take care of all of that. We call ourselves a support company with a software, so I highly recommend reaching out to us if you have any questions. Even if you don't have an account, you can come onto jane.app, open a Jane account, or even head to our videos and see like a overview of Jane in 15 minutes, kind of like what you're seeing now. Does that answer that?
That does answer that. We actually get in some big time questions for you, Alex. I think we'll leave that at the end here.
Okay.
But if you feel that's better suited.
Yeah, we can head into that at the end. Let me just show you our charting here, just so I can get that out of the way, and then we can talk about whatever else you guys might want to ask. So when it comes to charting in Jane, it starts with chart templates, and chart templates are another way to automate your business so that you're not, spending time fiddling around with your EHR trying to get it to work. Jane's designed to spend less time with your software and more time with your patients actually helping. So from the chart templates, I could either create a new template from scratch here, or I could also head into our template library, which is really cool. It's essentially a completely community-built library of different templates across every different discipline, which you might want to take a look at. So if I take a look and I go into maybe initial visit or something like that, I can view this. I'll say initial visit consent form or something like that. Perfect. I can then add this into my account. And with just a click of a button, I have an entire consent form here ready for me to use. I can then start adding on items. Like an important one here would be maybe let's do a body chart. Excuse me. We'll click in a body chart. And another integration that I'm pretty proud that we have is also our Fullscript recommendation. So you can also add that in when it comes to charting. You can then click on that button and you can start building them a Fullscript recommendation right in Jane. So let me save this. So we've pulled for our chart from the template library. We've already have that all set up, so that's great. I can then let me just sign in as Marcus Gregory here with our funny bottle password. And when I sign in as a practitioner, I get a slightly different view of Jane. I get this dashboard, which we call our practitioner's home base. And essentially this tells us some basic metrics about who our top patients are, who we're seeing the most of, our total visits for the last year, quarter, month, or even week. You can also see here what our top treatments are and who is booking the most. We also have a ratings and reviews integration, which you can use to get ratings directly from your patients. And then also we have our chart statuses here, which so you can see if maybe you left one in draft or you haven't started on a chart either. So there's a lot of useful information in this dashboard here, but the most useful I think is on our left-hand side, we have our calendar for the day. So on the left-hand side here, say at 8 a.m., Lily shows up for her appointment. I can simply click onto her appointment here. And that's going to bring me directly to her chart entries. And from her chart entries, I can either create a new chart entry using one of the templates that I just pulled from. Maybe it's that initial intake or initial visit consent form. I can add that in. And then Jane's going to allow me to just fill it out, click wherever I might need to, and add in any questions or concerns about that too. Down below, I can also use our body chart here. I can then draw on this body chart. Maybe I want to give it, oh, excuse me. I'll use our little pencil tool, maybe draw some little eyes on it and a smiley face, or I could be a little bit more serious and then I can say this elbow needs to be looked at and I can point an arrow to that too. And I'm just using this on a mouse and keyboard here. If you're more comfortable on like an iPad or any other device, any device that can run, that has an internet connection, can run Jane. So if it's an iPad, you can directly draw on here. If it's a laptop with a touch screen, you can also do that too. So very cool. And kind of one of our really cool integrations here with Fullscript is that we can build a Fullscript recommendation directly in a patient's chart. So if I actually just want to do just a Fullscript recommendation, I'll choose that from our new chart entry. I can then build a Fullscript recommendation right from here. And Jane's going to pull that Lily already has a profile in Fullscript. Perfect. I can include a personal message. Oh, yep.
Just a little side note there, when you're matching emails, make sure it's the correct email.
Yeah, for sure.
There have been instances where people haven't matched the correct individual, and that recommendation will go to the wrong individual. In those instances, you would have to reach out to Jane to reset that mismatch.
And it doesn't take long to reach out to us. You give us a call, we can fix that up for you, no problem. But yeah, Dallon's definitely right, and ensure that it's going to the right person there. But once we are ensuring this is going to the right person, we can make our Fullscript recommendation. And on the right-hand side, we can choose one of our templates that have been created in Fullscript. And we can then, oh, excuse me, apologies, 1 second here. I thought this would have it. It should.
Yeah, and as you're doing that, so when you actually create templates within Fullscript, the way we set up the integration is all that information will transfer over into Jane. So you can access your templates from that drop-down menu, which you will see Alex do in a couple of seconds.
Yeah, so once again, let me just put that Fullscript recommendation in. I'll build one again. And here I will ensure that I'm going to the correct Christina. And then I can load my products from a template on the right-hand side here. Maybe it's their first time visit. This is what I always give to my first time visits. And Jane will then list all of the products here, directly pulling from Fullscript's catalog. And I can add in any product I might need to, say like cortisol. Put the cortisol
So
calm
when
in
you
there.
select the particular product, you'll get a full description of the product. It's another feature that's brought into Jane with the integration here.
Yeah, it's directly pulled right from Fullscript. And then you can also change this if you want to administer them 60 capsules instead of 120, and the prices are directly here as well. Once I'm happy with that though, I've checked all of this, it's all good to go. I can add the product and it'll show up at the bottom of my recommendation here. I can then change this if I need, say, like half a capsule 3 times per day for 1 week. I can then change that, and I can do that individually with each of these as well. And those will then be listed on our chart. So then, once I'm happy with everything here, I can send this to our patient, and that recommendation is going to be sent to their patient by email. Now, another way is, not emails aren't always the most safe way, and some clinics don't prefer to send things by email. So we've also enabled a setting in Jane where we can share any chart entries or anything like that with a patient directly. And then they can open it up directly on Jane's PIPEDA compliant and HIPAA compliant servers, and they can then view that entire Fullscript recommendation outside of their email. So I'll click not visible to patient at the bottom of a chart. I can confirm and notify the patient, say, hey, here is my recommendation. Perfect. I can send that to them. So they'll get an email in their box saying a document has been shared to you, but there's no patient information in this. They'll just need to set up their account so they can access that. And that's just a username and password. But yeah, heading back to your chart, you can also see our Fullscript recommendation is going to be there. If I need to duplicate this for another recommendation going forward, I can duplicate this and so on and so forth. Once I'm happy with this and I'm good to, I'm done, I can then sign off on the chart, sign as myself, and you'll see this chart is now locked. I can't change this. I can't delete this or anything like that, although I can amend it if I do need to. And like Alan said, any amendments do need to be tracked. So if I insert an amendment here, it'll say the exact time that I inserted that amendment and any edits I may have made. It won't delete anything. It'll just add in another amendment. But that is essentially our chart entries here. One other really cool part of Jane is that we also have a telehealth feature. So again, to bring back that face-to-face kind of integration over online in our changing world. If I click on our appointment here, I've booked in Christina for an online video session. So once that online video session begins, say 12 o'clock comes around, a couple minutes before, Christina's going to get an email saying, hey, your telehealth session is about to begin. She can click on a link in her email. And when I click in here as a practitioner, give me 2 seconds here. I just need to share my screen a little separately. And we'll change this to, excuse me, there we go. Okay, perfect. And you should see my face now on our Jane video telechat. And this is entirely private, safe. There's no recording. It's entirely through Jane's servers. There's nothing like going through another Zoom server or something like that. It's entirely patient to practitioner. No one else can see this information. But let me just switch back to our Jane view. And there we go. And just like that, we can join a telehealth session with the click of a button. We can then chart for the patient all within Jane while we're doing this. We can take payments if we need to by clicking pay over here. Say pay for their online video session. We'll add a new credit card if they haven't already entered in one. Hopefully this works this time. It should. Ooh, excuse me. And then we'll save that. Oh, of course. Perfect. So we've saved our information for the credit card. I can then pay and print a receipt or pay an email receipt to the patient, whatever one I choose. Jane's going to then list that invoice as paid. She's now owing $0. We don't have to chase her down for any money or anything like that, and we're good to go, essentially. But I'd be happy to answer any questions. This is basically a quick rundown of Jane.
Yeah, so there's a couple of questions that did pop up. I think it might be a good time since people are really interested.
Of course.
One question that did come up for telehealth, to both types and have the video, would we have two windows open side by side? So it's looking at the format of how the video show would look like.
Yeah, for sure. So yeah, with our telehealth sessions, it would be each time you click that begin button in the top right here, it's going to open a new window for you. So whether you're using a Mac or a PC, you can just open those two windows side by side, so you can chart on the left side and then see your patient on the right. It'll be in two completely separate windows, so you can do them simultaneously for sure.
Another question, it's centered around billing and insurance.
Sure.
Are you able to do billing and coding to insurance plans?
Yeah, exactly. Yeah, you definitely can. Let me actually touch right into that here. So I'll just with Christina here, I'll head down to our insurance info section. Actually, give me 2 seconds. Let's use Hannah, actually. That works fine. I'm just trying to manage this webinar panel here, but let me, okay, maybe these are bad examples. But let's say demo owner. This is a good example here. On our appointment, on the right-hand side, we'll head down into his insurance info. I can add a policy here and either add private billing codes or an entire policy. So I then select their insurer, and this is a customizable list of all of the insurers that you would, submit to, whether you're a US clinic or whether you're a Canadian clinic. Our insurance works relatively similar in Jane, just with a couple tweaks for each one. But with, say I'm submitting through TELUS eClaims, I can choose Canada Life here. I'll type in a name for internal use. The only really required section of this entire form is the claim or employee number. And then finally, the rest of this I can fill out as well. So if it's maybe the patient isn't the one that's insured, maybe it's their spouse or something like that, I can also enter in their information. Otherwise, if I have a policy maximum here, say they have a maximum of $500 to spend towards this, Jane will also count this in the background. And once we reach that policy maximum, she'll let us know saying, hey, maybe it's time to make a new policy once you reach that $500. Same thing with the maximum number of treatments. If there's a max of 12 and we're currently on our 10th or 11th or something like that, you can enter in all of this information and Jane's going to track this for you as soon as I hit save here. Oh, let me just, excuse me. Fill that in too. We'll click save. And now we have a policy saved to the patient's account. So if I can then enter in billing codes here, say 12345. Oh, there should be something here. Say, okay, excuse me. I've been working on the US side of things, so my billing code knowledge isn't that great. I'm not a doctor, I will say that. But any sort of billing codes here, whatever you have, you can set these up in our settings here, into our billing codes, and you can then find whatever billing code you might need. Type in, injection, something like that, and you can see everything with injection in it. You can add it to your account and how much Teleplan is going to pay for that too. Let's say we head back to our schedule. We'll click once again on the demo. Losing my place here, that's okay. Our demo owner for Canada Life. Once again, we should have that 12345, but it's not popping up. That's okay. But we can check any sort of eligibility for their codes, all of that information. It goes directly to TELUS eClaims. Once they receive a response back, that'll then go directly into your billing section and into all of your claim submissions. So you can then track which ones have been unsubmitted to Teleplan. You can then validate those, make sure that everything is correct, and you can also send those out directly through Jane too. I'd highly recommend, if you wanted to get a little bit more into the insurance info, we have a whole bunch of guides on our Jane guide here as well. You could also book a demo and reach out with any specific questions, and you'll be matched with someone for like an hour, basically.
Great. So a couple of questions that pop up about mobility. Is this fully optimized for mobile use? Can you access this on your cell phone?
Yeah, entirely. Any device that can basically connect to the internet, Jane, you can run it on Jane. So whether that's your iPhone, as long as you can connect to, Safari, and all you'd have to do is type in your demo.janeapp.com, whatever URL you have, and it'll work pretty much exactly the same. Of course, a little bit optimized to, a phone's view or a iPad's view or something like that. Jane's a dynamic software, so she's going to shrink, mold, and adjust herself to fit your device.
Great. And there's a lot of questions about Jane, but the one that does keep popping up frequently is about US and Canadian servers. Do you store information separately
Yeah, great
between
question.
the two countries?
Yeah. Privacy is like one of the top things on our mind here at Jane. So all of our Canadian servers or all of our Canadian clinics are stored on Canadian servers in Quebec. And then all of our US servers are, we actually don't even know. Only 3 people here at Jane know where the US servers are. And as well with those ones in Quebec. And those servers, they host everything from top of the line 256-bit encryption, which is the same as like online banking, as well as actual physical man traps for if you don't pass a retina scan, you get trapped into like an actual like small little prison. So there's all of your data is completely safe. We've never had a breach here at Jane, and privacy is at the top of our mind. So we're constantly upgrading that level of security.
Perfect. Yeah, and so the last question is actually a Fullscript question about how they're able to integrate their Fullscript account. I can actually kind of touch on that a little bit, and you can actually show where you'll be able to set that up in Jane here. The first one, of course, is to sign up for Fullscript. It is free. All that we require from the practitioner is their credentials when signing up for a Fullscript account. It's any professional credentials that they might have. That gets reviewed by our team here, our quality team at Fullscript. When you're approved, you're ready to go. You're ready to start recommending supplements. When you're in your Fullscript account, you need to generate a clinic key, and that's actually found in the dispensary settings underneath Integrate. You'll generate a simple clinic key, and then when you go into Jane, you simply find the integration section, find where Fullscript lives, as Alex is showing you right now, and then type in that clinic key here. You'll also select the country it's associated with, and then you can go ahead and click Integrate. So it's a simple, easy peasy integration for with Jane. And the beauty thing about the Jane integration, it can support multiple practitioners that have different Fullscript accounts.
Yeah, so every staff member in Jane can have their own Fullscript account, so they can have their own templates, their own list of clients, so that your list of clients doesn't coincide with another one's, and so on and so forth.
Now, I know I said, Alex, that was gonna be the last question.
Sure.
But we do have more popping up, so I'm gonna give the audience what it wants. A couple questions that did pop up is surrounding around credit cards. Is keeping credit card on file a safe idea? That's one practitioner that's asking about.
Yeah, so it's actually it depends. I will say keeping a note of someone's credit card is definitely not a good idea. But when it comes to Jane and our integrations, one of our integrations here is Jane Payments. And Jane Payments is what you've been seeing me use for entering credit cards and all of that. And so Jane Payments is an integration both with Square as well as with Stripe. And if you know anything about those payment integrations, they're top of the line, well-regarded companies when it comes to processing credit cards. And since these are integrations, there's actually no credit card information stored in Jane. There's just a token of each patient's credit card. So like you can think of it as like the last 4 numbers of a patient's credit card is on a patient's file, and that's it. Essentially, every time that you're going to go process a credit card through Jane, when it comes to using Jane Payments, I should say, you would then have to, go through, it would process that credit card through Stripe or through Square, whatever one you're using. And then from there, there's nothing that is saved within a credit card in Jane's system. It's all outside of Jane with Stripe and so on and so forth.
Perfect. Another question that did pop up is there a way to hold a credit card until the actual session?
Yeah, there definitely is. In our online booking settings here, you can set it so that I just set it for online booking requires full payment, but you can have this as either a deposit or even just a credit card on file so that you have some sort of collateral. And then after the session comes, or even if they no show, you'll have that credit card on file and you can just choose however much you want to pay them. One other cool thing about Jane as well is that you can set these to individual patients too. So if maybe one patient you have a problem with, they don't they don't pay for their stuff on time, you can make it so that that specific patient needs to have full payment before showing up, or deposit before booking an appointment, or something like that too. And one more cool thing to this is you can also differentiate between your first visit payment policy and your regular client payment policy. So maybe the first time someone comes and sees you, the first appointment they book, they'll need to, put down a deposit of say $25. But after that, as long as they have a credit card on file, that's totally fine. Then we can just let them, they've paid once, they're kind of trusted clients at this point. We can then just go forward with just a credit card. They don't have to pay anything before. Does that help?
Perfect.
I think that answers it.
Yeah, great. Another one, it actually centers around super bills. So does
Sure.
Jane produce super bills that have diagnostic codes and visit codes that patients can use for reimbursement?
Yeah, excellent question. And I do have to just switch to our US demo site for this. But give me 2 seconds here and I can definitely show that. We definitely have super bills as well as any billing codes. It'll be an itemized list of all of those. So let me just sign in here. I can show you that directly. Let's just go off the top here, Gertrude Works. I can see that I'm using Gertrude here just by the way. I can see that she's covered by a Medicare coverage just from this little tag here, as well as this little briefcase indicates this is an insured appointment. But when it comes to that, I can head into my insurance section. Again, I have my billing codes listed here with their associated diagnosis codes. Come up to the top here. And if I click the button beside pay, I have an option to either create a CMS 1500 form or even a super bill here. So if I want to just email that super bill or print it right off, or even generate a PDF so I can save it myself, I can do that. And you'll see here, it's a completely itemized list of billing codes, diagnosis codes, and their different pointers, how much you charge for each of these, and how much the patient's actually paid.
Perfect.
Yeah.
Great. Now, when it comes to integrations, do you integrate with other laboratory or diagnostic facilities?
Yeah, as of right now,
medical providers. Oh, sorry.
Yeah, no problem. As
Go
of right
ahead.
now, we don't have any integration specifically with other, like diagnostic labs or anything like that. But I have heard of clinics being able to pull the information from Jane, whether it's their reports or their chart entries, and submit those to different labs outside of Jane. So currently, it's a third party or even fourth party, you could consider it, as it's not directly integrated with Jane. But pretty much everything you have on here, whether it's a chart or a report or something like that, you can export it out of Jane and upload it somewhere else too.
Perfect. Another question comes up, and it's going back to the writing of Fullscript recommendation in Jane. Now, when a Fullscript recommendation is written in Jane, does that information transfer over into Fullscript? So the simple answer is yes. So you have the ability, all the information, all the recommendation that you have written in Jane will be pushed into Fullscript, so we'll be able to keep track of that information. Another one is the search functionality within Jane for a recommendation. Alex, if you're able to go into a patient or a client.
Of course. Let's head right here. Excuse me, just again, managing windows here. I'll click view and then right into their chart. We'll create a Fullscript recommendation, build that recommendation here. Again, I'll just use Zachary Lawson. It's a matching email. And then we can add a product here.
Yeah, and so some of the questions that did pop up is around regarding the search qualities here. As you can see, you have the ability to discover supplements by the type themselves or by the conditions if you like. So as you can type in, let's say adrenal support, you can see all the items that actually, if you go back, sorry. If
let's actually go back to the actual category for sure.
Yeah.
Clear search.
So you can search by category or by supplement type. So if you look for adrenal support, it'll actually recommend products specifically for that condition. So, and then you click into a specific supplements. You can see a detailed description. Again, this is one of the Fullscript features that we actually pull into Jane here, or pushed into Jane. So you'll be able to see that. You also get to see if it's in stock or not when you do select the product.
Yeah.
Perfect. Great. I think that's we got a whirlwind of questions here. Too much that we can't get into. But what we'll do is get somebody to answer them offline here, guys. If we didn't get to your question today, but what we're going to do is jump back into the slides here. And we really want to highlight the benefits of the Fullscript and Jane integration. You saw Jane in action here, and then you also saw the portion of the integration in the demonstration. Now, we really want to talk about some of the benefits here. So by combining the two solutions, you're actually able to, number one, stay organized. You're able to consolidate all that information into one page or one location. So all that information is stored in Jane. You don't need to leave Jane. You can write your recommendation, you can do your charting, you can access your patient information all in one area without disrupting your workflow. The second point is increasing your offering. While incorporating supplements into your practice here or into your clinic, you're gaining access and increasing your offerings to your patients to include supplements within the practice altogether. The third point here, you're becoming a one-stop shop, or your practice is becoming the one-stop. Your solution is becoming a one-stop shop for all your practice needs. As I mentioned, you can schedule appointments, you can process billing, and write recommendation all without leaving Jane here. And then finally, you're improving your patient experience. Because improving patient experience, you're actually maximizing your time, retention, and revenue by using Fullscript and Jane tools to increase adherence and engaging with the patient when it matters the most here. Now we'll flip out to the last slide. I know we said we have a question and answer period here, but we're actually going to focus on some resources. So if you're new, if you're new to Fullscript or Jane, and you want some additional information, you can actually go into Fullscript's Knowledge Center. We have tons of resources that also includes managing your practice efficiently and effectively, supplement information. So if you're new to supplements, we do have some guides that can get you acquainted and teach you and educate you on supplements and recommending supplements to your patient. We also have protocols, which are really huge. These are evidence-based protocols that are popular amongst our practitioners, and it's a great way to get started. The third one is a specific resource that we have for getting started in your practice and setting it up to the online sphere. It is an educational series where we pull from multiple different resources. Finally, Jane's guide. I'll actually let Alex talk about it a little bit more. I don't want to butcher it here.
Of course. I'm very passionate about Jane's Guide, so I'm glad you let me do this. Jane's Guide, like I said earlier, it's basically, if there's any questions that we've been asked more than twice, we've created a guide on it. We have everything from a series of, if you're like a US insurance practitioner and you really haven't had that much experience, we have everything from setting it up in Jane all the way to getting paid and recording those EOBs. Canadian practitioners, we have everything from, TELUS integrations to our Fullscript integrations and all of that in between too. Whether it's a whole course for your front desk to run through or even your practitioners to run through, we have a slew of different resources here at Jane, not only in the guide, but like I said, we also call ourselves a support company with the software. So if you want to give us a call, feel free to. Our lines are open every single weekday, 7 a.m. Pacific Standard Time all the way until 5 p.m. So give us a call. We're happy to help you, or even shoot us an email. So yeah.
Perfect. For next steps here, if you guys are new to Jane or new to Fullscript, please sign up either for a demonstration. As I mentioned, Fullscript is actually free, so you can go ahead and sign up and download it onto your computer. All we just need is for you to provide your professional credentials. So we'd be able to approve you in our system, and you can go ahead and recommend supplements from that point on. Also, if you do want to integrate the two solutions, we actually have a page where you can actually see how easy it is to set up the integration and some additional best practices for the integration itself. Now, I think, Alex, is there anything that you want to talk about? I think we're good to go. I do want to thank everybody for taking time out of your day just to sit down here and watch this webinar. But yeah, thanks so much.
It's an absolute pleasure. Thank you so much for having me, Alan. And again, if you want to talk to us, let us know. Come and book a demo with us. We have lots of time open, so we can talk to you and talk about your business. We want to hear about you and your clinic. Thanks a lot.
Take care, everybody.